All right, that's fine. Recording is ongoing. Thank you for that. So please, if you are not speaking, kindly mute. I'm hearing some background noise. Kindly mute your mic, at your own end. Please kindly mute your mics, okay? Thank you. So this is 7:18 p.m. And this means that we will need to rush so that we can cover, what we need to cover today. I will be speaking to us for quite a bit, and then eventually Ekaterina also will come up and share with us really it's a project that he managed. How did he go about it? What were the results? Basic things really. So we are going to be doing two of those today. Please, I'm still hearing some noise in the background. Kindly mute yourself. Thank you. All right. So our training outline. This will be our training outline. We're going to be having a brief introduction. Then we're going to delve right into project phases. Tomorrow we'll be talking about essential skills and the tools that you need to function effectively as a project manager. All right, as I said, this is not an exhaustive training, but this can set you on your feet. This can guide you in the right direction. This will help you to not be confused at a certain point during project management. All right, now, I also need to say this. People have this notion that project management is one very big thing, something that is national and all of that. No, it doesn't have to be national, okay? It could just be you going to that school. It could just be you going to that school, for health sensitization. That's a project, yes. Yes, it could involve testing, it could involve screening, it could involve a national campaign, it could involve a global campaign. Beautiful, but the basic principles still apply nonetheless. All right, so with this outline, we're going to cover the basics. All right, so let's move right into it. Introduction. Let's move right into it, okay?
Sorry for the interruption, can you make it full screen, like click on the icon so it can be full screen?
Dr. Ogamba, I can't really hear you. What did you say?
Yeah, can you make the presentation full screen, like
I tried doing that. I had some, so it's kind of makes it hang. Let me try again anyway.
Okay. Okay, if it's not working, we can continue like this, so we don't delay one.
Yeah, that was what I thought initially. Okay. All right. Okay, yeah. So I guess we're good now. All right. So what is public health really? Because a lot of people have joined this training from different departments, different backgrounds. All right. And they're interested in public health. And you see, that's the beauty of public health. It's not restricted to only health professionals. You can come from any background, literally any background. You have an interest in a health issue, you're welcome. All right, you can learn how you can go about it, and you just take action, really. So that's the beauty of public health. There are no restrictions. So public health, basically, according to the American Public Health Association, is a practice of preventing disease and promoting good health between groups of people, from small communities to entire countries. So remember, I had earlier said that a project can be as little as you maybe mobilize your own community, or going to a primary school, or speaking in a PTA meeting, that's Parent Teachers Association, yeah. Or it can be national, it can be global, it can be continental. really. So the important thing is that we are preventing and we're promoting health. That's the important thing. We're preventing and we're promoting health within a community, all right, which can now vary, whose size can now vary. And a project is a combination of set objectives to be accomplished within a fixed period. Now, if you notice, I underlined specific things there. There's a fixed period. We have a set of objectives. We don't just wake up and say, distributing self-testing HIV kits sounds like a good idea. I think we should do it. No, those things have been carefully thought out. All right, those interventions have been planned. Those interventions, we have actually done research, to find out, does this thing work? Will this thing actually help? Will this intervention actually bring about these outcomes? So we have a set of objectives, all right, and then there's a fixed period. A project cannot run on end. Now, there are 20-year projects, there are 50-year projects, but guess what? There is still a time frame. You cannot just say, we'll see where it takes us. It is not a project. It is a wish, it is a hopeful thinking. I don't know, it's something else, but it's not a project. All right, and the next definition says it is a sequence of tasks that must be completed to attain a certain outcome. So that means we're looking towards something. There's something we want to achieve, what we can call a goal, right? And we have to list out all the steps that we need to take to get there. So if we don't have steps, if we don't have a clear goal, if we don't have clear objectives, we're not talking about a project. We're talking about something else. I don't know what it is, but it's not a project. All right. Another definition said it is a temporary endeavor with definite beginning and end, which means that start and end. Okay. So if we have this in mind, so what is project management? Basically, it is us applying our knowledge. You're going to be getting knowledge in this training. You're going to be getting skills. You're going to be learning about tools. And you're going to be learning about techniques or strategies on how to make sure that that outcome, that goal, those objectives that we set out to achieve, that, okay, these are the way we are actually going to, achieve them. So your job as a project manager is ensuring that we get to the outcome. Ensuring we get to the outcome. All right. And that definition came from the project management body of knowledge. All right. They have a very, very good book. Honestly, the PM book of knowledge. Yeah, it's a very, 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 very instrumental book. All right. It is literally a body of knowledge. It has all project management principles, the tools, and how you can navigate things. Very useful. You should download it. The recent one is the 7th edition, but I think the 6th edition is still in circulation. So yeah, you can look out for that. It's quite large though, so if you're interested. So why do projects fail? Because the reason why we need a solution is that there's a problem. And very likely the problem here is that some people have set out to accomplish some outcomes, but they didn't quite get there. So why do projects fail? That is why you are needed. The reason why projects fail is why you are needed, because you are needed so that this project does not fail. All right. So poor planning. This means as a project manager, you need to know how to plan. And if you're talking about a public health project, you need to know how to plan a public health project. It is not the same way you plan a construction of a building. It's not the same way you plan your friend's wedding party. All right. Yeah, some basic principles apply, but public health, there are some things you need to really look into. So poor planning, unrealistic goal setting. We want to save the entire world. I'm sorry, you can't. Yeah, really. Unrealistic goal setting can make projects fail. Poorly defined scope. So we're going to be talking about scope very soon. If we are not clear on what is the X, Y, and Z of this project, if we are not clear on it, you may get some people on board and they will do X, Y, Z, A, B, and E. And that will not cost more money, more time. In fact, it could even lead to the project failing entirely. scope mismanagement, which is your duty, ineffective and insufficient communication. The people that work on a project need to be clear. The stakeholders involved in the project need to know what this project is about. And in fact, it's not that they need to know. Everybody needs to agree on it together. That's how you get buy-in. Okay? So if communication is not clear, let's say it was clear initially, but then along the way, you lost touch, you didn't give status reports. Somebody that could have helped you, maybe somebody that works in, let's say, the Ministry of Health, that could have given you expert advice, because you didn't keep the person apprised, you just lose out on that opportunity. And that alone can lead to a project failing. If key community stakeholders are not part of your constant communication, you're not constantly giving them feedback, you're not you didn't even consult them in the first place, and you're going to do projects in their community, it will likely not stand. It will likely not even last for long, if it even stands. All right. Some other reasons why projects fail: risk mismanagement, unrealistic schedule and timeline. We want to build another London Bridge in 3 months or in 1 week. Hey, I don't know, but it doesn't sound realistic to me. All right. Risk mismanagement, there are problems that can arise if we don't foresee them. If we foresee them and we don't have a plan to actually navigate those risks, we might actually be in serious trouble. Yeah. So those are some reasons why projects fail. All right. And since we're talking about public health, I need to highlight this important fact that health is, by its very nature, a community issue. Somebody being diabetic is not just one problem. It's not a problem that just appeared from nowhere. There are various factors that contribute to that. All right. And if you look at this slide, I highlighted community 3 times, just for emphasis sake. Just for emphasis sake. It is by its very nature a community issue. That is why when we're talking about health, we talk about who, why, what, when. What are the factors? Who is involved? It's not just one thing. It's not just, the health problems are not just standalone, okay? So many things cause them, or at least more than one thing does cause most health problems, all right? And if you're going to bring an intervention, if you're going to create an intervention that's going to solve that health problem, you have to have this in mind, that community, 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 community. It can be supportive, it can be positive, it can be negative. The community can influence positively or negatively, but you understanding that this is a community thing is very important. Please mute your mics if you're not speaking. Thank you. Thank you. Thank you. Please give me a minute. I need to mute. All right. Noise is not palatable at all. All right, so sorry for that. Let's continue. So I just had to put this slide to give us an idea. Public health projects. I think I've said before that they're not like construction projects, for example. Yeah. In public health, we're trying to solve problems that involve people. People are at the center of public health. And our interventions have to focus on people's behaviors. I'm sure you must have heard this this saying. What do we say? We say information is power, right? Information is the best empowerment. Behavioral change is so important in public health. In fact, you are advised to prioritize interventions that will influence behavior over hit and run. Yes, dear. So in case you have a project now and the project is not going to address root causes, it is advisable, if you're going to adopt a public health approach, all right, that you focus on behavior. At least you incorporate it into your current plan. Focus on how to influence behavior, how to influence people who live in a certain area to clean up the environment. Not just you going to clean the environment every Saturday. How do you make the people who create that dirt to change their mindset, to change their outlook, and to adopt that change that you want to see them adopt? So interventions are better focused on people's behaviors, all right, and how changes in the environment can support those behaviors. If you have, I don't know if you keep in touch with the news. So I can't remember the country now. They wanted to reduce the rate of crime, yeah, in a certain region of the city. And what did they do? They lightened up all their streets, and then they changed the colors of the light. It wasn't blue, I think it wasn't white, it was now blue. So that was a change in the environment. That was a change in the environment. So naturally, crime rates dropped. Not because they arrested more people, not because they flogged more robbers, but somebody looked at the environment, observed behavior, did some research and said, let's try this out. And it was tested and it was proven that, hey, this works. So you focus on changing people's behaviors. You also look at the environment. Now, let me also now say this, that it is true that most of us here, we may be starting small. We are not at that national level or World Health Organization level, where you can do big things, in quotes, yeah? So your project may not be able to be all-encompassing, but it's good you have these principles in mind and you can inject them into your own interventions as much as is possible, depending on what your resources can carry, okay? So components to consider when designing your intervention. There are 4 things: providing information and skills training. Providing information, help sensitization, help promotion. Do these people even realize that this is a problem? Is that where we should even start from? Maybe they don't think it's a problem. So you could start from there. Health sensitization. Enhancing support and resources. That's another point. Okay, is it that they want to change, they want to improve on this particular issue, but they don't have access to primary health care? So you can maybe refurbish their primary health care center. You can pay doctors or nurses to be there, right? You can, help them start up a drug revolving fund. That's you providing support, that's you giving them resources. Another thing you can do, you can modify access and barriers. So, for example, in some parts of Nigeria, even in some parts of Africa as a whole, there are beliefs that a woman giving birth through cesarean section, it may be a sign of weakness or something, or it's a spiritual problem, stuff like that. And so, because of that cultural belief, people, when a woman is in labor for long and there is no progress in the labor, instead of them doing the next best thing, leave the midwife and go to a hospital, maybe a tertiary hospital, yeah, or at least one that can offer surgical services, they say no, that it is against their own cultural belief. So how you can modify the barriers for that woman to seek care is for you to go and do a health sensitization in that community. Yes, modifying access could also be you partnering with another organization that is probably in the engineering field. Maybe they provide good network of roads. Perhaps those people cannot even go to a hospital because it's too far or because they don't have a good network of roads. Your organization can say, okay, this is what we're going to focus on. All right, another point is monitoring and giving feedback. So your intervention, now there's a problem. Most projects, especially small scale projects done in Africa, we have not yet adopted this data mentality. We just take these things for granted. We don't keep our data in one place. We don't even collect data. We don't even, take it very serious. Okay, let's even know before and after. No, we just say, this sounds like a nice idea. Let's go and do it. We'll go and do it. Nobody knows if this worked, if it did not work, if there's a way to improve it. We don't learn anything. Somebody comes tomorrow and say, okay, they did that. Or let me do it here. And you just reproduce it. and we just have these nice ideas, but did they really work? We don't know. So monitoring and giving feedback is so important. You have to factor that into your intervention. How are we going to track progress? How? All right, and how are we also going to give this community feedback that, oh, look at the problem that we notice in your community, and this is what has happened, this is what you've partnered with us to bring to you, and this is the improvement. Give them feedback. Let them also be encouraged. Let them also be motivated. Let them also see the benefit of partnering with an external organization in bettering their lives. Okay, Hassan, you raised your hand. Do you have something to say? You can unmute now.
So actually, I want to add from.
I can't really hear you.
Can you hear me?
Yeah, what did you say?
Yes, actually, concerning the monitoring and giving feedback that you've said, I have an observation. So I want to add to what you have said. Here, it's either we engaged community leaders or members so that everything you plan to run your project, I think it will go smoothly as planned. So when we are at the topic, please, I want you to at least explain vividly to most of our participants so that they will get it at least. They will get it and can be used in changing their community behavior toward positive behavior. That's what I want to just say. Thank you.
Okay, thank you very much, Hassan. Thank you so much for that.
Thank you.
Thank you. Yeah. All right. So yeah, he was just trying to reinforce what I said about monitoring and giving feedback. Yeah. Yeah. So lastly on this slide, if you see that, I said it's advisable to run a pilot intervention and evaluate, but I understand most of us do not do it because of financial constraints, but it is still advisable. As much as it's possible, test before you scale. Test before you scale. And let me say this, that the things I'm teaching here, I am not just teaching for small projects. I'm also preparing you because you're going to have a certificate. And a big organization could just say, oh, you have this skill, you have this knowledge, come and manage this project. So I'm also trying to balance that, all right? Helping us understand the small context, but also being able to function in larger scale activities or projects rather. So let's move on. Let's move on. Let's move on. Oh. All right, so what are the phases of a project? What are the phases of a project? If you go through some books, if you take some trainings, it will tell you five stages, 6 stages. You know what? We're just going to work with 4 here. Initiation, planning, implementing, and closing. Simple. Let's just simplify things, all right? Initiation, we plan, we implement, and we control, and we close. That's what we're going to do here. So in some trainings, they'll tell you before the initiation, we have to originate the idea, we have to ideation, all those things. You know what? Just don't worry, don't bore yourself with that. All right. So you have an idea already. You've seen a problem, you want to solve it. Let's get right into it. So 4 phases. That's what we're going to talk about today. Phase 1. Phase 1. Phase 1. You have an idea, you've seen a problem. There is high rates of teenage smoking in a community, and it's bothering you, and you want to do something about it. Where do you start from? you've been ruminating about it in your mind, or a friend shared it with you at work or in school, and you want to start something, you want to do something about it. This is where you start from. So the initiation phase is everything that occurs before the project is approved. So let's say that there's an organization that you work with. For example, I'm part of Youth Health Action Network. I'm the program manager of Youth Health Action Network, and we have, you know, a series. We have 3 programs really that we do in Youth Health Action Network. And let's say one of us comes and says, okay, in this my community, I noticed that let's say the person's a med lab scientist and the person works in the rural health clinic, for example, just a random example. And the person says, oh, I noticed that in the past 2 years, we've been having high rates of hepatitis B positives, okay? And I think I want to do something about it. I mean, Johan, that's an area Johan focuses on. So that idea is there already. Phase 1, initiation. It encompasses everything before project approval and detailed planning. So before you get the stamp, like, yes, let's go for this project. What needs to happen? We have to clarify some important things. What are the objectives of this project? Really, be clear on it. What does this project want to achieve? Because you see, as a project manager, you can't be controlling something you don't fully understand. You can't be managing something. You can't be managing a vehicle. You can't be driving a vehicle where you don't even know where it's going. You don't have a map. You don't have a destination in mind. So we need to clarify what are the project objectives. And in fact, if you're writing a proposal for a grant, all right, or some sort of funding, they need to see the project objectives. When they see it, they can know, okay, this sounds like something we should invest in or not. Mind you, your project objectives can be so wonderful, they can be so clear, they can be detailed, but the funders may not take to it, not because it's bad, but maybe it's just not their own area. Don't take it personal. But it's good it is clear in your own head as a project manager. Because when you're bringing other people on board, you're going to have to explain to them that this is what the project is about. Even if it is a web designer who is going to design the sites for the secondary school outreach or something, that person needs to know this is where this project is going to, this is what we're trying to achieve. It needs to be clear. And I always tell people, it is forgivable if the other people on the team do not really know about this project, like into like that. But you see, you as a project manager, it has to be very clear to you. So what are the project objectives? What are the project constraints? And usually we'll talk about triple constraints, but I included another constraint here, quality. Yes, so the triple constraint usually used to be scope, schedule, and cost. All right, we're managing scope, we're managing time, we're managing money. But I also included quality because in public health, quality is now becoming a thing. Nobody is taking, that thing that happens in the past where you just wake up one morning, you have money, you go to one community, do something, take pictures. Nobody is taking it anymore. There is now criteria for the quality of a project. All right. So quality is a constraint because quality is also affected by the amount of money you have, by the amount of stakeholder buy-in you have. Yes. Quality can also be affected by the policy, the prevailing regulatory conditions in that area. So we need to be clear on the objectives, we need to be clear on the constraints, and we need to be clear on success criteria. How do we know that this project was successful? How do we know that? So let's get right into it. The first thing that you need to do is to research the needs of the target communities. Oh, no, you thought because you saw a problem, it is your problem. It may not be, and please don't be shocked. Research the needs of the target communities. So you notice hepatitis, you notice an increase in hepatitis B incidents, or you notice increase in teenage smoking, or you notice increase in teenage pregnancy. You notice a problem. And you want to reach out to these people in, give me the name of a community now. Let's say in Gwale. right? Or in Kano State. I'm in Kano, so that comes to mind easily, all right? But you don't just wake up and say, hey, you guys, come here, I want to do this for you. No, you have to go to them. What are the prevailing problems? Perhaps you will notice that the problem that you saw at surface level has deeper factors that are even affecting them. They have deeper issues. And possibly, if you can narrow down your intervention to one or two of those issues, that surface level problem that you saw can actually be solved. So first of all, go to the communities. Now, the community can also involve you going to the primary school. Don't forget that. You might, okay? So it just depends on what is the community of your own project, all right? It can be you going to your classmates. It can be you going to the professors in the university. It just really depends on what your community is. What are their needs? What problems are they facing? Analyze it, look at it. What are the factors that are contributing to the rise of teenage pregnancy here? Is it because the women are not empowered, they don't have money, so they depend on men anyway, and then the men, bank on that? Is it that? Or is it because they are illiterate and so they don't really care anyway? Or is it because it is acceptable in the community? What is the problem? What is the problem? And then you go to the community and you see that what they actually need more, it's not just you coming to talk to them. Hey, girls, don't get pregnant. Or hey, people, stop sleeping with people. Or hey, stop. You will now see that it's beyond that. We may need to focus on female empowerment. We may need to focus on contraceptive awareness. But if you don't do the research, if you don't go to this community, you will not know this. Analyze the problem. You decide who are the primary targets of change. Who are the primary targets of change? Who are the agents of change? Targets of change and agents of change are two different sets of people. Two different sets of people. All right. So, for example, if you want to increase immunization in babies, all right, the targets are the babies, but the truth is the person you're going to meet is the mother. The person you need to influence is the mother, or let's say are the parents. So the target, that is the core beneficiary, that's the babies. But then the agents of change, the people who you would need to meet, who can influence the outcome of this your intervention, the parents, maybe their community leaders, okay, their market women leader. Do you understand? Those people that they listen to, that can influence their own opinions, those are the agents of change. For the beneficiaries, at the end will be the children, okay? So next thing to do is to identify internal and external stakeholders. So I think I've mentioned that already. So these agents of change, they're going to be external stakeholders. Yes, because they're going to come from the community that you're going to reach. So for example, when we do self-breast examination, that is a Save a Breast campaign project, all right, in senior secondary school, all right, that's girls secondary schools, of course. We don't just wake up on Monday, say, okay, Johan, let's go and talk to these people. Hey, all of you, give us 1 hour. No, you first of all go to the principal or the head of the school, right? You talk to them, you have to make them buy into what you want to come and do. They're the agents of change, at least to a certain degree. They are stakeholders. You need to identify that the stakeholder here is the principal, the teachers, the senior school prefects. These people, these are stakeholders that you need to work with. In the community, it could be their religious leaders. Then internal stakeholders within the organization that you work with. For example, Johan, I'm the program manager. We have a chief executive director. We have project coordinators. We have state coordinators. There are coordinators at too many levels. You need to know who should be involved in this particular project. Sometimes sometimes within Johan, all right, we can merge two programs, so to speak. So since we are going to do a breast cancer awareness, talk, we could also merge mental health, something like that. Now, those are two different programs, and so the stakeholders that are involved are more. Okay, I hope you get the point. So identify internal within the organization, and external, within the community, the people that you need to work with. And you map out an engagement strategy. Tomorrow, we're going to be talking about now that is a core skill. Stakeholder engagement is a core skill of a project manager. It's a core skill. So tomorrow we're going to be talking about that, all right? How to map out a good engagement strategy for your stakeholders. Then you're going to focus on affecting the cause of a problem. So remember earlier I had said that you are just seeing a problem from outside the community. When you enter the community and you talk to them, either using a survey or you do focus groups, or you go house to house, ask some questions, go to their leaders, ask some questions. Why is this happening? Have people noticed this? Can you give us an idea on why this is happening? They will lead you down to the root causes, which you would take note of. All right. And then you can now use that information to decide on what to eventually do. And then you set goals, you set objectives. A goal is usually an umbrella statement. We want to improve the health of community XYZ. An objective is clear. I'm going to tell you how to know a very good objective. So let me leave that. Then you're going to research best practices. Okay, so want to reduce teenage pregnancy. You go online and you check. What are projects that have worked on teenage pregnancy before? What did they do? What resistances did they face? What were the how did they go about it? Was it successful? Was it not successful? How does it apply to the context of this environment, of this community I want to currently influence now to carry this intervention? Research the best practices. World Health Organization has standard protocols. They have recommendations on eradicating hepatitis, on eradicating Buruli ulcer, on tuberculosis. They have protocols, they have guidelines. Research best practices. Don't just wake up and run. No. You ask questions, you make inquiries, you network, you look for people in this field, look for experts, talk to them. That, in this community, I noticed this particular problem, but there's this cultural belief that also, kind of colors the atmosphere here. How do we navigate that? You maybe talk to someone who is experienced in implementation science, or you talk to someone who is skilled in community ownership and engagement. You get ideas. You rub minds. Now, this is something like a very, very, very long process. Well, depending on how big the project is, well, it may not take that long. If it's a very small project, for example, you just want to go to a secondary school and you only need to meet the principal, the head teacher, and the teachers, that shouldn't take you more than a week or two, right, to sort out. All right, both the research and the stakeholder engagement. It doesn't take you that long. But if you're talking about a national program, 6 months, a month, really, it could vary. All right, so I'm not going to give you a time frame for this initiation phase, but these are the things that should happen in the initiation phase. You research best practices, you check past interventions. Why did they work? Why did they fail? What about these other ones can you apply in your current context? All right, let's move on. Oh, my time is really, really far gone. All right, we're still in initiation. So I just put this, what I call it now, a screenshot. So analyze the problem. These are the questions you should be asking. Why are these ladies at risk of smoking? Is it because their mothers smoke? Why do these ladies, why don't they do self-best examination? Is it because, well, they don't know about it anyway? Their mom doesn't have breast cancer. They don't know anybody that has breast cancer. They've really not seen it. So they don't really know. They don't have a TV in their house. I don't know. What are the factors that put them at risk of this? Genetics? Do they actually have people in their house that have suffered from prostate cancer, but they attributed it to a spiritual problem? So ignorance is a risk. As you can see now, in public health, it is a risk. All right, so what behavior caused the problem? Whose behavior or lack of behavior maintains the problem? So for example, boys or men who grew up in families where their parents, drank and smoked, very, very likely it's going to influence. Even if their parents didn't, if their peers did, all right, it's going to influence. So whose behavior or lack of behavior caused and maintains? Very important. So really, you can go through this list. I'm going to make the presentation available, okay? I'm going to make it available so you can go through these questions and ask yourself these questions, all right? And when I mean ask yourself, it's not just you, because you're supposed to work as a team. All right, every other person, especially the internal stakeholders, the core project team working with you to produce or create this intervention, you people need to brainstorm on this together. All right, but I'm just going to move on. I can't dwell on this now because of our time. Now, I had said I was going to share with us something about setting objectives. It should be aligned to the vision and mission of the organization. All right. So if your organization works on mental health, for example, you can't be telling me that you're providing cervical cancer kits or mammography. I don't know, where does that come in? All right. It can, but you have to find a way to link it. Even though it sounds so far reaching, you can say, okay, you want to focus on mental health for women surviving cancer, something like that. Yeah, now that sounds more like it. But it has to be aligned to vision and mission of your organization. Okay, I think that's a no-brainer, right? It should include all of the SMART plus C criteria. So we know the SMART criteria already, and then the C is very important. It should also be challenging. Let us not just rest back on our oars and say, no, we can't do this. Let's not do this. And everybody just rest. Take up some challenge, okay? Take up some challenge, really. Push yourself just a little bit further. You never know what's going to open up, all right? Objectives should measure behavior change and community outcomes. So, for example, this one I gave now, rate of teen pregnancy. Anybody that looks at this objective know what we worked on. They know the age range, all right? They know the time frame. They know the measure. Like by 30%, it is clear. Nobody is confused on what outcome we are trying to measure here. And finally, an objective has to be realistic, okay? Now, even though I said it should be challenging, doesn't mean it should be unrealistic. You can still combine both challenging and realistic, okay? So as per project management, in the initiation phase, what we're going to bring into this phase is the theory of change. Unfortunately, I can't go into that. It's part of the monitoring and evaluation, process. But theory of change is really how does our organization move from, where we are to that goal that we want to get to? What are the steps? What do we do? What are our activities? And how do we get there? Really, that's really a theory of change. You can look it up. You can note that down and look it up eventually. So theory of change, or plus or minus business case. Now, I don't want to assume that everybody here is working in an NGO. Okay, there are some for-profit organizations who also carry out public health interventions. So also bring in the business case. Why do you think it is a good idea to carry out this health intervention program in this real estate company? There may be a very strong business case to it. So add it, bring it into the phase and brainstorm on it. All right, grant specific requirements. Now there are also unique circumstances where the grant already has that target. These are the people who want to reach. This is the intervention that we're looking at. Can you do this or can you not do it? So you need to factor that in. Okay. And then your findings from community research. So these are inputs. These are things you bring into the table, that you put on your table rather, and then everybody looks at it and then uses what we have talked about here. These. All right. Beautiful. So the deliverables. So after you have answered these questions in the initiation phase, you should have a project charter. We're going to talk about that tomorrow. Basically, it's just a high level, summary of your project and what you intend to carry out. You should have a RAISY chart, which we'll also talk about tomorrow. Who is responsible for what? Who is accountable? Who has been consulted for this? And who has been informed about this? So you have to have that chart. All right. So it is, well, let's say a subset of a stakeholder engagement kind of, chart. So it is clear on who is responsible for what task, what deliverable. You also need to have a communication plan, because in a project, you're not going to be communicating with everybody every day. Some people just need to be informed on the status once a month or twice in 3 months. That's the truth. All right, different stakeholders, we communicate with them at different levels depending on their role in the project. All right, so that communication plan is very important. And then the project budget. How much do test kits cost us? T-shirts, the transportation, projector screen, all of that, the manpower, the feeding, all right? You factor in all those budgets, all right? If you need to pay a fee to the community or something, put that in your budget. And do not forget to add miscellaneous. Yes, dears, don't forget that. All right, there has to be a risk management plan. It is possible that this community will not accept this part of the intervention. If this happens, what do we do? It is possible that this vendor will not get this, what now? HPV test kits in so time. If this happens, what do we do? Risk management plan. This is a risk. This is something that could go wrong. How do we manage it? All right, so you include that in your brainstorming session. And then the project schedule. So we want to do this project. Remember, we said that a project has a time frame. Yeah, so a schedule like a breakdown. We're starting in March. This should end by September. So we have a schedule. In March, first week of March, this is what happens. March 15 to 17, this is what happens. You have that high level idea. Now, at this phase, you may not know all that detail, but at least you just have a rough sketch. Okay? And all these other ones. And then you submit your proposal and go for approval. Yeah? So in phase 2, 8 to 4 p.m. Okay, let's run. So in phase 2, we're going to planning. You've gotten approval. They've looked at it. I'm like, wow, this is an awesome project. I really believe in this. I look forward to it coming to pass, everything. Now you have to come back to the table and plan. You have to come back to the drawing board. So those high level things that we did in phase 1, we're going to bring all of them into phase 2 and zoom in on them. So in public health, when you're planning an intervention, there are many models really for planning. There are many models, but I just chose this Precede and Proceed model because I did not want to assume that everybody here has managed a project before and so they know what to do. This model, even somebody that has no idea, you have never, ever, managed any project before, you can look at this model, all right? You can implement it. Of course, you can tweak it depending on the context of your own community. You can look at this model and guess what? You can manage that project effectively and nobody will know that this is your first time. Yes, so that's why I decided to highlight this particular model. It's the Precede-Proceed model. Just in case you've never heard of it, Precede stands for predisposing, reinforcing, and enabling. What's predisposing these people to this health issue? What are the factors that are reinforcing this health issue? What are the enabling constructs? All right, Proceed is policy, regulatory, and organizational. So at the policy level, for example, now in some countries, marijuana has been legalized, isn't it? In some other climes, it has not been. So the kinds of interventions that you may carry out in those countries, they'll kind of differ because of the kind of policy and regulatory, climate that exists in that community. So you factor that in, the organizational construct too. How does the organization operate? How do you people go about carrying out your project? You need to factor all of these things in. So if you look at this model, that is phase 1, phase 2, 3, 4, 5, 6, 7, and 8. All right, so phase 1 is also a bit more like the initiation phase where you're asking questions, you're looking at the environment, the community, the environment in which they live in, what factors are, making these things thrive. You're looking at what are the factors that are really, really contributing to their health, genetic factors, what are the behavioral factors, what are the environmental factors. And you're looking at what is predisposing them to this, all right? What behaviors are reinforcing? I'm sorry I can't go into all of this now. I was really hoping I would dwell on this, but because of time, I am not going to do that. So I'm just going to give a high-level overview, okay? But it's really understandable, and you can really check this online. It is widely available, and you can learn more about it. But basically, in phase 1, you're doing a social assessment. All right, you're looking at the people, you're looking at their behaviors, you're looking at their relationships amongst themselves and how this could be affecting their health. Phase 2, you're doing an epidemiological assessment: who, what, why, when. All right, and then you're bringing in the behavioral component, the environmental component into it. In phase 3, you're looking at what behaviors. Now it's like you're zooming in, predisposing, reinforcing, enabling. because this is going to affect your intervention. How? When you are, for example, drafting your curricula on health sensitization on what now? Let's use our teenage pregnancy example. I think we should just continue with that. When you're, putting together what you would say to these people or how you will go about the health sensitization, because of your background understanding of these factors, you know how to tailor the message. You know how to tell the story. Storytelling is a big thing. It's a big deal. It's a very, very big deal. But you see, if you don't understand the context, they'll just tell you this one that just came from outside to come and talk to us. Does she know what we are going through? And they'll just dismiss you. And they'll dismiss what you have to say. Even though it is right, even though it will help them, they don't understand it. So you need to prove to them that you understand. Yes. You need to prove to them that you understand. And also, it also help you know how to, bring the intervention to them. What time is best? Do they all go to their farms in the morning and then you now say you want to do a health outreach in the morning? You may not see anybody, or you may not even see the target population. Yes, in fact, I've expressed that in a project. Well, I wasn't the one that managed it, but okay, it's fine. I experienced that, and it was not very encouraging because we had actually paid for some people, for human resource and all of that. It was just a shade out situation, really. So you understanding these predisposing factors, reinforcing factors, enabling factors. The mothers actually encourage their children to go and, maybe do sex work or commercial sex to bring in money. That could be enabling teenage pregnancy. Yes. What could be reinforcing it? A pharmacist refusing to sell contraceptive. I have experienced this one. I've seen this one firsthand, whereby now I'm a doctor, okay, and we had a rape case, and so because the environment in which that happened, I just happened to be there, luckily for them, and I told the woman, okay, go to a pharmacy, go and get this drug for your daughter and all of that. And the woman went to the pharmacy, and the pharmacist told her that he doesn't believe in it. That so he does not sell contraceptives. I was, oh goodness, I don't want to express that disappointment here. But I was shocked. First of all, that lady, you know what? I don't want to go into it. I don't want to go into it. But you see, that is a reinforcing factor. So that is a predisposing factor. Now, the fact that a pharmacist does not even want to share condoms or sell them, all right, or even make contraceptive available to them, that could be affecting their health in some way. That could be affecting their reproductive health. That is even a violation of rights, but let's not go into that, okay? So in phase 3, you look at the educational and ecological aspects, okay, of the community. In phase 4, as I said, policy and the organizations. Is this aligned to your organization's vision and mission? Are there policy factors, that are enabling or not enabling? Now, there are some policy implementation gaps that may be existing in that particular senatorial zone, for example. All right, because of their own cultural beliefs, they have told their senators, "Hey, I know your government has approved it, but it can't happen here." Is that something you need to navigate? So you need to factor that in. All right, so let's really proceed. Let's proceed. So you've done your research, you've been researching. How do we develop a winning strategy? In fact, how do we identify a good winning strategy, a strategy that we're going to implement this and it's going to work? First of all, any strategy that you are implementing has to have involved a participatory approach. As I said, you can't think out these things in isolation. All right, the stakeholders, very important. The committee, very important, because you need to get committee buy-in, you need to get stakeholder buy-in. All right, so there has to be a participatory approach to planning. And the thing about this approach is that it is easier when 5 of us just decide this is what we're going to do, let's go and do this. It is easier, it is faster. But we're also looking at long-term effectiveness here. All right, so the participatory approach, it takes more time, it takes more patience, especially when you have this organizational structure and things can be a little bit rigid, okay, when you have to go and implement something to the community. But if you can bring strong reasons that this community is different, these are some peculiar factors about this community, we need to take note of this context, as we're trying to implement this intervention. I know we did it in this other community, and it was so, it was widely accepted. In this other community, these are some challenges that we're facing. You have to let everybody know what the challenges are, what the problems are, what the resistances could be, so everybody can plan together. So it's going to take more time and patience and commitment, but it's better in the long run. All right, so everyone who has a stake, including the community leaders, all right, they should have a voice. So a good strategy will take advantage of current resources and assets. That's what a good strategy will do. A good strategy will not say, we need $11.4 billion to share mosquito nets. And in reality, you have just 1 billion. What can we do with this 1 billion? Seeing this problem that's currently in this community, that is the right question. What can we do with this current asset we have? We have willing volunteers. The community people are willing to be, enlightened. Take advantage of it. The community, have you heard of some interventions where they initially went there when there was a different traditional ruler, and then they were chased out of the community and cursed and all of that, and then they changed traditional rulers, and this other one is quite enlightened and is open to health interventions. Guess what? Take advantage of it. That is a key stakeholder that has just given you an opportunity. Don't sleep on it. Take advantage of that asset. All right, a good strategy would minimize resistance and barriers. Some people draft some health interventions, and people have to question that, okay, are you sure you're doing this for the community or for your own name? And you see, if people are not sure that you are there for them, there's going to be resistance. We talk about community buy-in. It's very important. Very, very important. So as a project manager, one of your core functions is communication. Communication. Oh my God, you cannot do without it. Communication is so very strategic as a project manager. And you need to make sure that this your strategy is reaching those who are affected. All right. You need to advance the vision of the organization. It has to be aligned. Okay. Then I'll come back to this thing about an action plan. I'm going to come back to it. So in planning, look at what you're going to brainstorm on. I've put this screenshot for you. There's a list of questions that can guide you, that can really guide you. What resources do we have? What obstacles are we maybe facing, or are we currently facing? How can we go around them? Whose voice can help us to navigate this challenge? The women are resisting. Who can speak to them? All right. What are the potential agents of change? All right. Do you want to reduce the existing problem, or does it make more sense to try to prevent or reduce risks for problems? All right. So remember, I talked about going down to the root causes of the problem and working on them. So depending on what you see in the community, you can now decide on what exactly you should do. You can go through these questions at your own convenience. This is an example of an action plan. What action or change will occur? Who will carry it out? By when? What resources? And then how do we communicate? Because you see, if we say we are going to do this and nobody's responsible for it, there's nobody you can call and ask, who did this? So has this been done? As a project manager, you have failed. If you cannot say this person is responsible for this, that person is responsible for that, this is the time I expect your feedback. If that cannot be clearly outlined, project management has not occurred. All right, so this is an example of an action plan. To prevent teen pregnancy, what action or change will occur? They clearly stated the actions. We have to hang posters, all right, in the school hallways, and they're going to become a permanent part of the high school. Of course, they must have gotten permission from the leaders in the school. Do you understand? Who will carry it out? X, Y, Z will carry it out. Who will give us funding? It was also highlighted there. By when will it take place? 6 weeks. What resources are needed? We need funding from the school district. We're going to approach that. Communication. Who do we need to communicate to? The school principal, leadership of the parent-teacher organization. Are you seeing this? Very important. So this is an example of an action plan. As I said, you have the presentation, the slides. Now, this slide is here because some of us will not really be working directly on, like addressing health problems directly like that. Some of us work on social determinants of health. Those non-health outcomes, or rather, those non-medical factors that influence health outcomes. All right. So some of us will be working on things like that, like, equity. Like, you not look at it and say, this is a health problem straight up. All right. Like improving access to healthcare. Maybe some people are marginalized from receiving care. All right. So if you're working on things like that are not straight up, health intervention, like straight up, and they are more on social determinants of health. This graph, the CDC, the Center for Disease Control, we have a full cycle. You create and enhance your partnership. It's still similar to the typical project management. You create an enhanced partnership, you focus on social determinants, you build community capacity, and then the cycle goes on like that. All right, so this one is very straightforward. In fact, I just had to put it here just in case we had some people who were not working directly on, health projects, like pure health, if you understand my point. Okay. And this is an example of a logical framework. I had also said that I was not going to lean into the monitoring and evaluation part. All right. But at the end of your planning phase, you should have something like this, like a table. Clear. Anybody that looks at this table now knows what this project is about. The person is not confused. The person knows how we're going to measure progress. The person knows what we're going to measure. We're going to measure these indicators. All right. We're going to be verifying it every 6 months or every 6 weeks. It is clear here. We are clear on what they want to achieve. 10% increase. It is very clear. They have a number there. They have a time frame there within 2 years. It is very clear. Now look at the column at the rightmost part, risk and assumptions. We have improved reading proficiency, provides self-confidence required to stay at school. So we may just be assuming that we'll have to go and do more research to know if this is actually correlated, as we suspected or as we assumed. So these are some risks and some assumptions, and they've also noted it down here. So it means that we can get into this project and we're going to learn something new, that, improved reading proficiency does not actually contribute to self-confidence. We may discover that, or we may discover that it actually does. So this is an assumption that we have in our mind. All right, but we're still going to proceed with this project and we'll find out. And that is the benefit of a logical framework. It helps us, learn at the end of a project. So phase 2, in summary, so during planning, all right, you're going to do more detailed exploration of what was done in the initial stage. All right, how are we going to accomplish what we're going to accomplish? Are we going to go for drug drive? Are we going to need to mobilize young women? Are we going to need to go to schools? Do we need to set up a website? Do we need to talk to the Minister of Health? Do we need to, what do we need to do? What do we need to do? Really, planning. And you break your project down into milestones. So for example, meeting the principal is a milestone, and getting his approval, that's one milestone. So you've gotten approval from the organization, you've gotten approval from the principal. The next thing can now be purchasing test kits. That can be a milestone. All right. So you lay out all the activities done. You set up your log frame. You highlight your risk management plan. If this goes wrong, what do we plan to do? This can go wrong. What do we plan to do? The change control process. Now, as a project manager, you're controlling scope. We want to reach out to girls who are 15 to 17, or let's say 15 to 20. All right, in senior secondary schools. What does that mean? It means that market women are not involved. Yes. It means that elderly women are not part of this. Even though they are female, they are not part of it because they're outside the scope of this project. They're outside the scope of this project. We are buying only HIV test kits. We are not also buying hepatitis B and what now? And which other test kits is there? Why is not coming to my head? Okay, we are buying only HIV test kits. We're not going to buy HIV drugs too. You're managing the budget. So the change control process is you saying, okay, if we go into the field and we need to tweak some things, how do we go about it? Who do I need to talk to? Who needs to know about it so we can take immediate action? That is change control. Because something is going to happen that is beyond our budget, beyond our scope, or beyond the schedule. So how do we manage it? So that is you defining the change control process. All right. And then you schedule task. Web designer, this is when you're coming in, and this is when we expect to finish. Vendor, test kit supplier. This is when we expect. This is when we expect it. This is when we're doing our project. So you have to be available 2 or 3 days before. So you schedule the task. Choma, you have to speak to this person, this person, this person, and give us feedback. Schedule those things. Let it be clear who is doing what and when. All right. And then how do we say that this project has been successful? So you develop the clear criteria for acceptance of the delivered project. So you can see that phase 2 really is like an improvement on phase 1. All right. So this is phase 3. I'm going to stop sharing my screen now. I want Ekachi Nelson. Is he here with us? Is Ekachi Nelson here with us? Just give me a moment. Let me look for him. Okay. All right. So Ekachi, you can unmute now.
Yes.
Ekachi, I'm so sorry.
Yes. Good evening, Dr.
I've taken quite some time. Yes. So I'm going to give him the floor now.
Yes.
He's our River State coordinator, all right, in Youth Health Action Network, Nigeria. And he has managed a project before. So instead of stories and long story, I said, you know what, I'm also going to bring someone who has managed a project. Let him speak to us. So Ekachi, are you ready for us? Are you ready for us? Ekachi, can you hear me? Oh, okay.
Yes, I can hear you. I'll be able to unmute you.
Yeah, all right, that's fine. So you've been unmuted.
Okay, good evening.
I believe you can share your screen. So yes, you can go on now.
Okay. Good evening, everyone. My name is Ekachi Nelson. As I was rightly introduced, I'm a public health worker, and I'm also the state coordinator, Johan Africa, River State chapter. So I'll be walking us through a project that I managed so we can all see the processes and the outcome of the project. So I'll go ahead and share my screen now. Please give me a minute. So can we all see my screen? Hello, can you hear me?
Yes, I can hear you, but I personally cannot see your screen.
Okay. How about now? Dr. Freeze, how about now? Can you see my screen?
Not yet, really, not yet.
Okay, I'll just go on while I try to fix that so we don't take much of our time.
All right then, thank you very much.
Okay, thank you. So good evening once again. So we did manage a project late last year. It was a sexual reproductive health project in River State, in a community called Elemi community in River State. So I'll go through the phases of the project, how we went through each of the processes, and how we arrived at our results. So the first stage, which is the initiation stage, basically, definitely when you are going into a public health project, you're going in to solve a problem. So you are going to definitely identify a problem that you want to solve, just as Dr. Praise had rightly mentioned earlier during our presentation. So there's always a problem that you're trying to solve in any public health project that you're trying to manage. So for us, the problem we're trying to solve is the problem of an increase in sexual infection amongst HIV infection among youths and adolescents in River State. So I'm into the HIV program in River State here, and we were having the Achieve Surge project, which is definitely a surge in testing and all of that. But we found out that over the course of a year, we had to make a shift in the whole HIV program in the state. Now the program is an adolescent, rightly so. In 2020, 2021, a project was carried out, a research was carried out in the state. It was a cross-sectional study for about 300 in and out of school students in the state, in one rural community in the state. And the results of that cross-sectional study was that there was a need for more advocacy campaigns and contraceptive campaigns in the state due to a high infection rate amongst these teenagers. So we looked at it and we said, okay, let's try to see how we can solve this problem. So goals and objectives. I don't know why I still am unable to, but I will just continue anyways. So we have to set out clear goals and objectives. So can you see my screen now?
Okay, yeah, so we're seeing that you've started screen sharing. So I guess that's an improvement.
Hello, now.
Okay.
So I'm guessing you can see my screen now.
Yes.
Okay, better. So this is a flow chart. This is a flow chart of our process for project, how we manage our project. So first we have the initiation phase. So after identifying our problems, which I've stated earlier on, we had to define our project goals, clear project goals and objectives. For me, I believe project goals and objectives are like the blueprint or the architectural design that you need when carrying out a building project. Because without the design, if I hold an architectural design or a blueprint, what to expect at the end of that project. So having a clear goals and objective was something we had to. And right here, this was our project goal. And the project aims to raise HIV infection awareness among youths in the Elimi community, as well as provide free HIV screening and prevention services to 100 plus vulnerable adolescents and youths, in brackets, male and female, and equip them with the information they need to live a sexually healthy life. Now, if you see our goals were quite specific as to our target audience, the number of persons we hope to reach, and where we hope to carry out this intervention. And by the side, you see our project objectives. We had two primary objectives and two secondary objectives. Our primary objectives were geared towards achieving our goals, and our secondary objectives were add-ons. So our first primary objective was to educate participants on sex education for adolescents and youths. And our second objective, primary objective, was to carry out HIV tests and counseling and referral for ART. While our secondary objective was to carry out hepatitis tests for 50 beneficiaries and referral for vaccination, as well as prostate cancer and cervical cancer prevention talks for men and female. So these were our objectives that would help us, or that helped us to achieve our set goals. So after that, what we did was identify our target audience. I think I've said that already. And from our goal, our project goal, if you just look at it, you already know who our target audience were. And our target audience from our project see was vulnerable, and how do we know? And how did we know which youths or adolescents were vulnerable at the time? In HIV programming, we have what is called risk assessment. So first of all, the community where these people stay, is it a vulnerable community due to some social determinants like lack of access to contraceptives like condoms, PrEP, and the rest of them? Is it a vulnerable community that lacks sexual education? And you just take all that into consideration to know the community where you are they vulnerable? And after that, the individuals themselves, are they vulnerable? Where you do risk assessment tests, the number of sexual partners they have, the frequency at which they have access to testing, to HIV testing, and all of that. We took that all into consideration before getting our target audience. And then after that, we had to identify the resources that we needed, both material, how we were able from our easily extrapolate that information that we need. So the resources we needed, we got it from our project objectives. So our objectives were to educate participants on sex education. So how did we intend to do that? So we had to sit back and think, okay, how do we do that? What was the best strategy to go about educating these people? We know a lot of persons might not be opportune to come to the exact venue that we had had in place for the testing and everything. So why don't we go out to them, take this advocacy message campaign to them? So we said, okay, the resources we need to do that, we probably will do a rally, and the resources we need for that would be a van. We need a van for that rally, so we could educate everyone, regardless of their busy schedule or whatever they were doing at the time that would stop them from coming in. Because our schedule for the event was the health education first in the morning, and then after which, towards the afternoon period by 12, we'll have the testing. So during that morning period, a lot of persons, we took into consideration that a lot of persons might not be opportuned or might be too busy to come out. So let us take this health education to them. So we thought about doing a rally, and what we need for the rally was a van and a public address system. So those were one of the some of the resources we needed. And also, in order to do HIV testing, we need HIV testing kits. So we needed that as well. We needed condoms, lubricants, PrEP, and ART, or an organization where we can refer any positive beneficiary for antiretroviral therapy. And also, while doing all of this, we also took into consideration that there was a need for qualified and trained experts in terms of testing and counseling. Would also require such services, and we took that into consideration as well as hepatitis test kits, the experts that we'll be needing, and all of that was taken into consideration as the resources that we need to pull off this project. So after that, we made the list of possible stakeholders, partners that we might need to pull off this project, and possible opportunities for collaborations. So now, after we identified our target audience, the next thing that came to mind is, okay, good, where can we actually find this target audience? How do we go about it? Okay, we went to the community. Do we go to the schools? Would that be appropriate? How do we go about it and everything? So in order to cut down the cost and everything, that's why Dr. Praise said something earlier about you sharing your getting advice from people you think that would be helpful to your project. And that is very true, because during the course of the project, after contemplating how we'd go about it, our venue, our target audience, where we get them and everything, I spoke to a friend of mine, and at the time, it would feel like, oh, she might not be able to help or something. But I spoke to her about it and said, oh, I'm trying to come up with a project. And this is what I need, and I don't know how to go about it for now. I'm just thinking. And she was like, okay, where do you intend to? I said, okay, LMA community, but I don't know how to go about it, transportation and all of that. And she was like, okay, that she knew Rotrat district they're having a retreat at that same community. And Rotrat is an association or a body full of youths and all of that. And I said, okay, that is fine. If we can get to Rotrat, since it's a retreat and it actually hosts a football match as well, which is something that can draw youths out and all of that, it's actually a good opportunity for collaboration. it's a good opportunity for collaboration to make this a success. And that was how it happened. And we were talking to someone that initially I thought would not be able to help, but just talking to the person anyways opened the door for open opportunities for collaborations for us with regards to this project. So we were able to talk to and they were already present in the community. Transportation issues of me going to the community and doing my assessment and all of that was cut short because I had them there already, and I could just call and say, okay, could you help me find this? Could you help me reach out to the chief and this one and this one? Let's find out so and so and so and so. So it's actually reduced the stress, and the such collaborations are necessary when having a project of such. You look out for people that can help you ease the stress or the cost of your project, and can help you collaborate. Collaborations bring more manpower to the table and also bring more resources to the table. So it's a note that we should also be very keen on collaborations when carrying out our projects. It's very, very important. So after bringing out a list of all the possible organizations, so we know we are doing HIV testing. So we have to look out for, okay, what organizations in the state can we meet or can we reach out to that could help out with HIV testing, hepatitis, and all of that? What organizations can we meet? And I know I wrote down a list of all the organizations in River State that could help out. But the thing about HIV testing is we always have target audience. We have key populations. There are some organizations that are just focused on some key populations, like people who inject drugs, OVCs, that is orphan and vulnerable children, female sex workers, and the likes of them. So first of all, I just drafted a list first, and then during the planning phase, we went in depth to look at this list and to cancel out those that their targets might not work with ours, or organizations who do not address the same targets as we wish to address. So there's a likelihood that they might not respond positively to our proposals, our engagements. Next phase, we have to determine stakeholders and their roles in the project. So from that list, we had to cut down on some. I know I met some organizations. I had to go meet some of their PMs. I had to have physical meetings with them. I know I reached out to River State Agency for the Control of AIDS. We had a meeting. I talked to them. They were apart from them supporting. It was also necessary as major stakeholders with regards to HIV testing and everything in the state that we reach out to them and show our goodwill and let them know that, okay, we're doing such a project in the state. And since they might not know our existence, because they actually opened doors to us, because through that, I was able to get other contacts that actually helped us out in the project. So reaching out to them, although they were unable to give us the maybe financial or resource support that we had in mind when we went to meet them, but at the end of the day, they directed us to persons that could help us and that did support and collaborated with us on the project. So I reached out to them and some other organizations. So after we had crossed out the organizations that there were no possibility of them helping out due to their own SOP or whatever, we were left with a few ones that we know that if we send a mail to them or if we reached out to them, there was a very high possibility that they would respond positively to our proposals. So after that, we sent out these invitations. We approached the possible stakeholders, and during this phase, I would just like to say something very important here. Dr. Praise talked about risk management and or risk mitigation and change management. It's very important that during project management, you try to be as diverse and vast as possible, because it's not advisable to put all your eggs in one basket. So I'll just explain what I mean by that with our practical example during our project. So we reached out to Association of Young Persons Living with HIV. So we reached out to them, and they were very excited about the project, and they wanted to be part of it as bad as possible. They wanted to be part of the project, and they gave us for the possible positive feedback with regards to the project. But then they had an issue. What we needed from them was human resources and material resources in terms of HIV test kits and all of that, to also reduce the cost on our budget with regards acquiring or sourcing those provide human resource, but they could not provide the material resource. But then they gave us positive feedback and told us to wait, that they are going to write to their PM and whatever for approval of the resources we need, that is HIV test kit, prep, and all of that. So we had a glimmer of hope that okay, that one was settled. But then I still wasn't satisfied with that, with just that. So I had to add a plan B or an alternative to that, because I wasn't really satisfied. A plan C, if possible. Yes. So when doing project management, it's good to always have risk management. Reach out to another organization, so give us positive feedback. And how many do you people want to test? We told them but they're satisfied. It's like I needed an alternative to my alternative. So what I thought, how much can we get? I called two primary objectives, and the other two were secondary. And one of the secondary objectives was hepatitis test. Primary objective in the sense that these are the objectives that will help us achieve our set goals. Hepatitis was not part of our goals, but it was an add-on to our project. So I said, okay, fine and good. If this doesn't work out, the worst case scenario that I can do is, okay, this our budget for hepatitis screening. We could cut in on that and get ourselves in test kits, rapid test kits. The manpower to do it will not be a problem. I can do it very well. I can cancel, I can tell. So they can do this plan, an alternative to my alternative, and another alternative to that alternative, in case things go south. You have to do your risk management. You have to, what do I do? So that was it. And fortunately for my thinking, the first organization we met, we were unable to protect native that came through, and that helped us out in terms of material resources. So that was why I said risk management is so resource for project resource